Bright red rectal bleeding can appear after constipation on Wegovy or Zepbound, but these drugs usually do not directly tear a blood vessel. In key adult weight loss trials, constipation affected 24% on Wegovy, 2.4 milligrams, and 11% to 17% on Zepbound, depending on dose. Hard stool and straining can inflame hemorrhoids, yet repeated bleeding still needs a real diagnosis, not an automatic assumption. Wegovy contains Semaglutide, while Zepbound contains Tirzepatide. Both drugs slow stomach emptying and reduce appetite. People may then eat less fiber, drink less, and pass stool less often. The colon keeps pulling water from stool. It becomes dry and harder to move, so pressure rises around the anus during straining. Hemorrhoids are swollen tissue containing blood vessels inside or around the anus. Internal hemorrhoids often bleed without pain. External hemorrhoids are more likely to cause tenderness, itching, swelling, or a painful lump. Constipation can worsen either type, especially when pushing becomes forceful or prolonged. The classic hemorrhoid pattern is a small amount of bright red blood after a hard bowel movement. You may see a streak on the stool, blood on toilet paper, or a few drops in the bowl. Blood mixed throughout the stool is less typical and deserves closer evaluation. Sharp pain during a bowel movement suggests an anal fissure, which is a small tear at the opening. A fissure can also leave bright red blood. Hemorrhoids and fissures can occur together, so the amount of pain helps guide the examination. Because constipation can drive both problems, its definition matters. It does not mean only skipping several days. Pebble-like stool, incomplete emptying, hard pushing, or needing your fingers to help stool pass also count. Someone can have a bowel movement every day and still be constipated when each trip requires major effort. The first response should reduce pressure, not irritate the area by wiping harder. Stop prolonged pushing and leave the toilet if nothing happens within several minutes. Repeated straining keeps swollen tissue irritated and can turn a minor streak into recurring bleeding. Next, make the stool easier to pass. Drink enough fluid for your medical situation, especially after nausea, vomiting, heat exposure, or exercise. People with heart or kidney restrictions should follow their own fluid plan instead of forcing large amounts. Fiber helps only when added carefully. Increase vegetables, fruit, beans, whole grains, or a fiber supplement gradually. A sudden large increase can create bloating and pressure. Fiber without enough fluid may leave stool bulky but still difficult to move. When food and fluid are not enough, a clinician may recommend polyethylene glycol, a common powder laxative. It holds water in stool and often causes less cramping than laxatives that force the bowel to squeeze. The goal is a soft, formed bowel movement, not repeated watery diarrhea. Other causes can stack on top of the injection. Iron, calcium, opioid pain medicine, some antacids, and low activity can harden stool. Review the full medication list because fixing another cause may control constipation without changing Wegovy or Zepbound. After constipation triggers are addressed, the same bright red streak can still lead to different plans. The drug may explain the hard stool, but it does not prove hemorrhoids cause the blood. One patient stops bleeding after the stool softens. The other keeps bleeding despite easy bowel movements. The first pattern often fits irritated hemorrhoids or a fissure. The second should not be blamed on constipation alone. Injection timing can create a convincing explanation even when the true source is unrelated to the injection. Persistent or unexplained bleeding has several other possible sources. Wegovy and Zepbound may create constipation, but they cannot prove where bleeding began. Small pouches in the colon can bleed. Bowel inflammation, infection, polyps, or colorectal cancer can also cause rectal bleeding. Expected treatment-related weight loss can hide another warning sign. Weight loss from a separate illness may be mistaken for the medication working well. New fatigue, shortness of breath, pale skin, or weakness can signal anemia, meaning too few red blood cells, from slow bleeding. The blood itself also gives clues. starting with color. Bright red blood often comes from the anus, rectum, or lower colon. Dark red blood may come from farther inside. Black sticky stool can signal bleeding higher in the digestive tract. Amount matters just as much. One thin streak after a difficult stool differs from blood filling the bowl, clots, or bleeding without a bowel movement. Increasing bleeding, dizziness, fainting, a racing heartbeat, or marked weakness requires urgent medical attention. Severe anal pain with bleeding changes the plan, especially with fever, diarrhea, or abdominal pain. A hard, blue, tender lump may be a clotted external hemorrhoid. 5 details guide urgency: blood color, amount, where it appears, pain, and whether bowel habits changed. Constipation adds a separate emergency pattern. Urgency rises when it includes vomiting, a swollen abdomen, or inability to pass gas. These symptoms can suggest a blockage or stool impaction, meaning a hard mass is stuck inside. After both drugs reached the market, severe constipation and intestinal blockage were reported. If none of those emergency signs are present, record whether blood was on paper, coating the stool, mixed inside it, or appearing alone. Also record stool hardness, frequency, pain, and any recent dose increase. These details help separate a likely surface injury from bleeding that needs a broader bowel evaluation. Take a photo for your clinician if comfortable, and note each recurrence. People may remember several episodes as one, making repeated bleeding seem less important. A simple record also shows whether constipation followed a dose increase. A dose increase deserves attention when constipation began soon afterward and remained difficult despite basic treatment. Contact the prescriber before the next increase. The better choice may be holding the dose longer or treating constipation more actively. Do not take an extra injection or increase early because appetite returned. More medicine can worsen nausea, reduce fluid intake, and deepen constipation. After a clinician identifies a minor local cause and symptoms are improving, continuing the prescribed treatment is usually reasonable. For short-term comfort, warm water soaks can reduce irritation. Clean gently with water or soft unscented tissue, then pat dry. Over-the-counter hemorrhoid products may ease itching or swelling briefly, but they do not identify the bleeding source or fix ongoing constipation. Avoid sitting on the toilet while scrolling or reading. Time on the seat increases pressure even when you are not actively pushing. Go when the urge appears, use a footstool if helpful, and leave after a few minutes instead of forcing a result. Arrange a medical visit for new rectal bleeding when the source is unclear. This matters especially when bleeding repeats, lasts beyond a day or two, or returns after treatment. Examination may include looking at the area, a gentle finger examination, or a small lighted scope inside the anus. A colonoscopy is a camera examination of the colon. It becomes more important with blood mixed into stool, bowel changes, anemia, colorectal cancer in the family, or overdue screening. A previous normal screening test does not explain new bleeding. New symptoms still deserve their own assessment. The safe pattern is simple. Soften the stool, stop straining, and address the medication plan before constipation becomes severe. At the same time, treat bleeding as a symptom to identify, not proof of hemorrhoids. That approach protects treatment progress without ignoring a warning sign. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.